Hello, and welcome back to the No More Trauma podcast. My name is Tanya, trauma survivor, certified trauma informed yoga teacher, coach, and wellness facilitator. My mission is to provide healing, mental health tips, and inspiration for living a trauma free lifestyle. You can find this podcast on Apple, SoundCloud, and on YouTube. So, for all of my returning listeners, welcome back. And if you're new, welcome. I hope you stay and feel free to follow and connect with me on all other social platforms. So, anyway, let's get into today's episode. Today's topic is developing addiction after childhood trauma. A quick episode to take a look at what the definition of addiction is, the types of addiction, how the addiction is developed, the impact on the mind, body, and even the impact on our loved ones, myths about addiction, and how it can be treated. And we'll look at the stats. So take a moment to feel free to think about what addiction means to you, your experiences or experience of others around you, or the thing that comes to mind. You can just take a moment, and I'll go in now to really take a look at the definition based off of the DSM. That's the Diagnostic Statistical Manual of Mental Health Disorders for Addiction. So the manual discloses it as impaired control, physical dependence, social problems, and risky use. And that's using more of a substance than it is intended to be used for, or longer than it's meant to be used. So the clinical definition of addiction is an addiction that is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It's considered a brain disorder because it involves functional changes to the brain circuits, which can involve those circuits for reward, stress, and self control. So, what I love about the the DSMs, threw extra D in there. I was looking at diagnostics and disorders at the same time, DDSM. So, the DSM definition is it doesn't use the words that first come to mind when we think of addiction, at least for me, drugs and alcohol. And so, what we can know, I think, as a collective, are there are um, greater objects that can fall into addiction, such as I think what we know as a collective, social media, the internet. It can also look like sex, porn, self harm, or infliction, caffeine, nicotine, gaming, gambling. I just kind of thought about even like shopping addiction. So, and the list can go on, but those are some of the types of addiction. But I just love the DSM. I'm now calling it the DSM now, uh, diagnostic and disorders instead of diagnostic statistical manual. And so how does the addiction, how is it developed? And so when we look at that, we look at addictions are primarily used to suppress traumatic experiences, memories, thoughts, and dissociate from present stressful stimulations, right? So avoiding that present moment, that could be very impactful with flooding sensations of trauma. The substance of choice can appear to slow the nervous system down, and it produces a pleasurable neurological sensation while altering that physical mental body by silencing and numbing from the past trauma. So individuals with childhood trauma with lack of healthy resources are more likely to engage in substance abuse and alcohol for this reason. So in early stages of childhood, children that were longing for parental attachment, reward, and reward, um, and that, wanting to display their own originality, uh, and, but unfortunately, they experience this harsh punishment, or they're left independently to self-soothe. Um, what happens is into adulthood, these similar sensations are activated by adults who are then seeking substances that temporarily soothe and elicit comfort. So the comfort begins to manifest as the negative choices and attachment to the addiction itself. So this early onset trauma then interrupts the brain pattern. So when we start to look at neurological, how it's affecting the brain, then what happens is it interrupts the nerve endings in the brain, the neurons in the brain, and its maturity. So there's a lack of growth in the brain, and the addiction becomes a remedy for pleasure, emotional pain, avoidance, craving, and sometimes habit. So now that we know how it can impact the body, or excuse me, how it actually manifests, right? How does it then continue to impact our surroundings and loved ones and the behavioral symptoms? And what that does is it looks like self control. It looks like a lack of self control, the inability to separate the physical and the mental sensations. And then we start to notice an individual becoming, secretive, right? Secrecy, which can then lead to interest in social environments that actually support the addiction. Other behaviors can include depression, sadness, anxiety, and sometimes rage. One of my favorite authors, as you always know that I talk about, Mr. Gary Zukov, he actually explains that alcoholism and drug addiction is an intense emotional pain. When someone is struggling with lack of self-control, secrecy, or intense emotional pain, it can cause separation from family and friends. So then there's isolation and then sometimes conflict and turmoil. So, looking into the myths about the addiction, you're likely to become an addict if you've grown up with someone with an addiction. That's not true. People with addiction are bad people. As we know, that isn't true. Addiction is a choice, not true. However, what I also like is that Dr. Gaber Mate challenges and expands on the last myth, right? That addiction is a choice. And he reiterates that the fundamental needs of authenticity, right, self expression, and attachment within intimacy and functionality of endorphin activity. When those needs aren't met, then it's the idea to find that within the substance itself. So it's not necessarily a choice, but it's the intention to fix, right? To fix the longing for authenticity and self expression, attachment, intimacy, to release and support that endorphin activity in the brain. So, how can it be treated? As much as I would like to say self awareness, right? I think, yes, I think anyone who there subconsciously there's an awareness. However, it may take something larger than that, and that may be a support group or support from our family and friends, maybe even coworkers, right? So it takes support. It takes even something larger than that, which may lead to detox and recovery or rehabilitation centers. What they may provide is something like movement, right? Whether that be yoga, maybe that, whether that be Tai Chi, or qigong, or intense physical activity, right? It may also include a shift in the diet or lack thereof, right? And it may also include the environment, a change in the environment. So maybe looking at the surroundings, if it includes nature, or is it a busy city? And so taking one out of a busy city that can be heavily stimulated and putting in and placing someone in a space that produces calm. So addictioncenter.com, as we start to look into the statistics, is 2020 when we experienced that global shift, 10.2% or 28.3 million people age 12 or older reported struggling with alcohol use disorder. And genetics also increase the likelihood of an addiction by about 50%, according to the American Society of Addiction Medicine. And in survey of metamorphine, excuse me, excuse me, methamphetamine dependent volunteers that met the DSM criteria, 56% affirmed that they use the drug for pleasure seeking, while 30% uses it for avoidance and craving. So two large numbers there, 30% and 56%. And so what do we know now, right? We know what addiction, how addiction, we know what it is. We know how it manifests, right? We know who it can impact, but we also know now that there are opportunities for recovery. And so addiction is a symptom for greater emotional longing and misunderstanding of self. Survivors of childhood trauma, such as neglect, abuse, or abandonment, can later become adult victims of addiction and find premature attachments to unhealthy substances. The addiction becomes a remedy for pleasure, emotional pain, avoidance, craving, and sometimes habit. This can impact survivors' livelihood. However, there's good news, and that which is support. There's great support and courage for survivors, and they can welcome healing and recovery. Recovery can support survivors on the journey to rediscovery of self, right? Mental freedom, security, and abundance. I thank you so much for tuning in to this episode. I hope this has brought some awareness or inspiration for healing, right? Or maybe some sort of confirmation for healing. And feel free to share this episode with anyone who may need it, right? You can always come back to it. And if you found something in this episode that resonated, feel free to like this episode or leave a comment and start some dialogue. I thank you again for tuning in. There are resources that I will also attach to this episode, and feel free to stay connected. So I ask that you live abundantly, love your authenticity, and radiate organic happiness, but most importantly, live a life of no more trauma. And quickly before we depart, I do want to share that there is an episode, if you join me in the virtual studio for trauma recovery, on the YouTube platform. You can find an episode that I'll also link here uh, for addiction and obsessive behavioral behavior. You can find a yoga head episode and you can flow with me. So I look forward to seeing you in the virtual studio. If you also, uh, you know, follow me on the social platform as az.nomoretrauma. All right. I thank you again for tuning in and listening, and I'll see you back. Namaste. Trauma free.